Well, thank you all for joining us tonight. It's really my great honor to kick off this event celebrating and recognizing the Power Project. The power in that title is the power of knowledge, because knowledge is power. And I think what we're going to talk about tonight is how important it is to provide every woman with breast cancer with the essential knowledge that she needs to participate in all of the decisions that are going to be made about the management of her breast cancer throughout her experience with breast cancer. I know this firsthand after almost 30 years as a breast medical oncologist myself, imparting the knowledge that I felt my patients needed. And I think what's most touching about this whole subject is that for the women that I cared for who came in newly diagnosed with many questions and uncertainties and fear, my goal was to have them leave with peace of mind that came from the knowledge that I could impart to them. And I think what you'll hear about tonight is how critical the genomic knowledge from breast cancer is for making all of the important decisions, not just whether or not chemotherapy is necessary, but all the other important decisions that will really decide the course of treatment. So we have many experts on this topic on the stage tonight, and without any further ado, I will hand things over to Dr. Princess Thomas.
Thank you so much. Hello to everyone. Good evening. Thank you all for joining us. We are excited to be here. I am Dr. Princess Thomas, and I am so excited to be on the panel with these ladies today who are not only survivors, but thrivers. And we are going to hear a little bit about their stories today and how they got to where they are. But just a little bit about myself. I am a breast surgical oncologist in Mooresville, North Carolina, right outside of Charlotte. And I'm in private practice, and I definitely use MammaPrint Blueprint because it definitely changes the practice of breast cancer treatment today. So without further ado, I will have each of you ladies just tell us your name and where you're from, and then we'll dive right into it. So we will start with you.
Okay. Hello, everyone. And I always have to start by, of course, giving honor to God because I'm truly grateful and blessed to still be here. I am LaTanya Davis. I am a 53-year-old, almost 5-year breast cancer survivor. I am from Orlando, Florida, but I live in Miami, specifically South Beach, so there's some partying that goes on occasionally. And like I said, I'm just super grateful to be here amongst all of you, and of course, certainly amongst my breast cancer survivor sisters, and Dr. Princess, who I recently found out was also my sorority sister. So
Absolutely.
Wow. It's truly a blessing, yes.
Thank you. Thank you.
I am Mari Safran. I am from outside of Philadelphia. I am 52 years old just a couple of days ago, and I am a 5.5-year breast cancer survivor. And I'm really happy to be here also.
And I am Carrie Grunman, and I am with Agendia as a result of my breast cancer 9 years ago. And I am 59, which you could have surmised anyway when I start to tell my story and how long I have been breast cancer free. So I'm thrilled to be here.
Perfect. Thank you, ladies. Well, we will dive right into it, and I think we'll kind of use this flow, if you will. So, LaTanya, we'll start with you. And the first question is, tell us a little bit about your initial diagnosis and the treatment plan that was presented to you. And then how did that change as you started to do your own research?
Okay, so I'll try to get through this without getting emotional. But I actually, could you repeat the question one more time? I want to make sure I answer.
Yes, absolutely.
Chemo brain is real. You guys just witnessed that.
So tell us about your initial diagnosis
Okay.
and the treatment plan that was presented to you. And then from there, how did you doing your own research into your specific breast cancer, how did that change?
Okay. Yeah, so I was actually diagnosed HER2 positive. And I actually, because of the history of breast cancer and cancer in my family, And I'm blessed and fortunate enough I knew the types of cancer, the relatives in my family. So that allowed me to really have engaging conversations with my entire oncology team. And initially when I was diagnosed, I was treated at the Miami Breast Center, which is where I'd always had my mammograms, my 3D mammograms. And as you can imagine, being an African-American woman, I had really dense breast tissue. So Dr. Carrie Hortz at the Miami Breast Center, the day that I went in to have my mammogram, as was typical, they always wanted to do extra screenings. And on that particular day, she saw what she thought was just like a little tiny cyst. And she said, you know what? We can have you come back in 2 weeks, or we can, do a biopsy today. And I said, today, because typically I wasn't really nervous, and I'll tell you a little bit why in a little bit. But as a result of having that screening and having a care team that I'd gone to for years, I trusted. For me, it started with trust. I had a team that I'd always trusted. And it was also me having the power and empowering myself to understand my family history. So that's what I would really say is how I took control, because unfortunately my family is really small and I've had a lot of loss due to cancer. And so for me, it was really understanding the importance of knowing family history. And I'm also a marketing person, so for me, consumer insights, medical insights is important. So it's like, wait a minute, I want to make sure that I don't become a statistic in a not so good way. And so I really, made sure that I told her, like, yes, let's do a biopsy today. I was hoping that it was, of course, a cyst, but I'm here. Obviously, that was not the case.
Thank you. And I think that we all know that trust is very, very important, especially when it comes to our cancer team. So that's definitely the beginning of things there. So thank you for that. And we'll dive a little deeper in just a little bit. But now I will ask you the same question, Mari. Tell us about your initial diagnosis and the treatment plan that was presented to you. Mm-hmm. And then from there, how did that change as you started to do your own research?
So in March of 2016, I was diagnosed with invasive ductal carcinoma of the right breast, and I had 2 tumors, each a little over about 2 centimeters, and one, there was a considerable amount of fear might be infiltrating my chest wall. And so my initial course of treatment was going to be very protracted. And as a matter of fact, I was, complicated enough as a case that my breast surgeon had strongly recommended that I be screened for participation in a trial called I-SPY. And among other things, what that trial did was it repeated my biopsy and my MRI, and it provided me with some additional testing beyond what my own treating institution normally did. They used one kind of genomic testing. This trial protocol used mammoprint. And so that would end up affecting me a couple of times. But the first step I took for myself was to know my chart and every single piece of data about my cancer like my life depended on it, because it may. And I would wait for new notifications from my EHR about a new report or a new diagnostic, or even just a new note or referral from physician to physician. Like, I was waiting for a new car to come into the driveway. And every single time something came in, I would comb over it. And so as I was going through the I-SPY protocol, things would come in quite frequently. And I was scheduled to start chemotherapy. This was Friday. A whole bunch of documents started flooding into my EHR. And I was scheduled to start chemotherapy, I believe it was the following Thursday. And one of the things that was shared with me the day before was that I didn't actually qualify for I-SPY because, thankfully, my tumor had a very low likelihood of recurrence per mammoprint. So without the I-SPY protocol, I was turned over to the traditional treatment team, and my chemotherapy was set to begin in about 5 or 6 days. And this flood of documentation came in. And one of the things that I noticed as I read all of the I SPY protocol documentation, is that my repeat MRI contained a very interesting sentence. And that sentence was to the effect that there is no suspicion of chest wall involvement. And this was a Friday afternoon, so I got on the phone immediately thinking, I need to find oncology and I need to find surgery, because I'm scheduled for chemotherapy in about 5.5 seconds here. And if I don't need to have it, I don't want to have it. So I did manage to reach my oncologist, I did manage to reach my surgeon, and they did a multidisciplinary team review the following Monday, now 3.5 days before chemotherapy. And they sat down and they reviewed this new MRI together and all of the film and decided that, no, you are correct about what the implications of this are, and you are not going to have chemotherapy. You're going to go directly to surgery. And the difference that just that first piece of information that I noticed myself made was to knock 5 months off of my treatment timeline. Originally intended to be about 15 months, I was able to abbreviate it by 5 months just by noticing that MRI.
That's powerful. That's awesome.
It was really lucky too.
Absolutely. Be your own advocate. That's
Right?
huge. That's
Yeah.
huge. So I will
So true.
pose the question to you again,
Yes.
Carrie, and that is, tell us about your initial diagnosis and the treatment plan that was presented to you, as well as how did you, doing your own research, potentially change that?
So I had my annual mammogram, and I was 49 years old at the time, and it came back suspicious. My radiologist said that I needed to contact a breast specialist, and that started a whole series of events where went in, she was a rock star, and just said, we're going to take care of you right now, we're going to do a biopsy. So they did the biopsy. When it came back, it was invasive, and they decided, because like Maury, there were 2 tumors, that she made the recommendation of actually doing a mastectomy, but unilateral, just knowing my personality. She didn't see any activity in the other breast. And I just remember, and going back to something that Dr. Thomas had said, when she gave me the information that it was invasive, she said, I just want you to know, no one ever dies of cancer to the breast. And that actually has resonated with me ever since, because all of a sudden I could breathe and I could listen somewhat. It was a little bit like in Snoopy, where you hear the wah, wah, wah. So I had my husband was in the room and taking lots of notes. And she laid out a plan and showed me different options, some of which we'll get to in a moment, involved genomic testing. She talked about the surgery. She talked about the outcome. She talked also about genetic testing, which I had. And my overall diagnosis was very low risk. So it was ER/PR positive, HER2 negative. I had ultimately no lymph node involvement, stage 1A, 2 small tumors. And based on what she had said, I thought, okay, everything's going to be good. After the surgery, I actually was going out already talking to groups and talking about dense breast tissue, because I thought that was going to be the biggest issue that I had to address. And I was a little wrong. So.
Awesome. Thank you for that. Okay, we will start back at the top, LaTanya. And the next question for you is, tell us, how did genomic testing, how did that impact your journey?
Wow. So if you didn't notice,
That's a loaded question.
I'm wearing a blue jumpsuit. And I was joking with Marnie and a couple of people. I'm like, I'm a walking billboard for Agendia. This is what I call Agendia Blue. I'm sorry, tech guy. You're probably like, don't tap the mic. So what I didn't say earlier, I'm actually a former athlete. I ran track all my life and in college, and I lost my mother to triple negative breast cancer. And of course, as I became an advocate, I understood that, as you alluded to, it was actually metastatic triple negative breast cancer. And my mother had 2 daughters, my sister and I. And so 6 months before my diagnosis in 2016, I lost my only sister to metastatic triple negative breast cancer. And so, as you can imagine, it was devastating. You know, losing my mother was like nothing will ever compare. But I still had my sister. And crazy enough, my sister had lost her husband to a sudden heart attack in 2014. And they had a son together, and he was 7 when his father died. And when my sister passed, I literally held her hand as she took her last breath. My nephew, my neph's son, as I call him, who's back in Miami, like rooting for me, he was 11. So I moved him from Orlando to Miami Beach with me, and I go to have that mammogram that I mentioned to you earlier. And I was just like, there's no way I have breast cancer. This is just the dense breast tissue, whatever. But the biopsy, of course, revealed that it was actually breast cancer. My surgeon, breast surgeon at the time, you know, when he looked at the, you know, I can never say this, but in layman's terms, it was very close. It was HER2 positive. And because my oncologist, Sarah Garrido, was so thorough, and she was actually really good friends with Dr. Manny Torres-Salix, which cancer took his life 2 years ago. And I have to share with Manny, I'm sorry, Marnie, please forgive me, but I'm always showing off his work, but he did an amazing job. Like, I had a bilateral mastectomy, nipple-sparing mastectomy, and he did an amazing, beautiful job. But at the time, I was diagnosed with HER2 positive, and Dr. Garrido, who was, as I mentioned, really good friends with him, she found it really odd that both my mother and my sister were triple negative, and I wasn't. And I remember, actually, who gets excited about any cancer, but I was super excited that it wasn't triple negative because, as I'm sure many of you know, triple negative affects, you know, the rate of incidence with Black women is super, super high, unfortunately. And the rate of survival is, you know, we don't have the same survival rate as our counterparts. And so Dr. Garrido said to me, she said, you know, there's this Agendia test that I'm not sure your insurance is going to cover it, but they're an amazing company. They will work with patients, you know, if your insurance doesn't cover it for some reason. But she said, I just really want to be sure because I find it really odd that you're not triple negative. And I was able to have that conversation with her, again, because I knew that both my mother and my sister were triple negative. And in the midst of me being an almost 5-year patient advocate now, I meet so many people, they have no idea like what type of cancer. Right. And so that's one of the reasons like I'm really advocating, not even for me anymore, it's about the women and men that will come behind me to make sure that we normalize talking about cancer. Because had I not known that, I actually was on a treatment plan for HER2 positive. I had started my chemo, I had done like 2 rounds of chemo. She got the test results back. And I'll never forget, because I'm a marketing person, so I think in terms of like logos, and I will never forget, I love the Agendia logo. And I remember getting that letter, and I was triple negative. And that's why I'm so grateful to be here. Sorry. Because were it not for, and I used to tell Jeff this all the time, were it not for the salesperson, I always said, like, I want to meet the salesperson that sold my oncologist, because she's really tough. And you know, you're a physician. Like, she made sure she didn't allow her professional preference for whatever your competitors are. She said, this is a test that we need to use that I just want to make sure. Had she not did the due diligence, I wouldn't be here talking to you tonight. So I just want everyone in this room to know, like, everything that you're doing matters. And, you know, I worked for Pepsi, and I used to I used to market Dom Perignon and Hennessy and all those amazing brands that some of you probably have consumed. But this is not Coke or Pepsi. You're saving lives, and that's why I'm here. So I know I took a long 400-meter route of answering your question, but the reality is genomic testing played a huge part in why I'm here. And I say thanks to all of you and everything that you're doing every day to save the lives of patients like us.
That was powerful. Thank you. All right, you are next. Mari, how did genomic testing, how did that impact your journey?
It made all the difference in the world for my journey too. Probably not quite as much for the severity of disease, but definitely for the course of my treatment. So I had mentioned that originally with ER/PR positive stage 2B cancer of my right breast, originally my treatment plan was going to be protracted, and it would include neoadjuvant chemotherapy, it would include surgery, it would include adjuvant chemotherapy, it would also include radiation, and it might even include, more surgery before reconstruction. And because I was so committed to reading my chart, I noticed that MRI before the neoadjuvant chemotherapy, which let me go right to my mastectomies. And I do say mastectomies plural because I had opted to have a prophylactic left mastectomy as well. And my mastectomies were performed on April 18th of 2016. And this was a really lucky day to have mastectomies. And my surgeon, when she came to visit the next day, I already knew I had no lymph node involvement and I had clear margins. So the prior concern about chest wall involvement turned out to be moot. She was able to get everything out. But she also said something that I thought was astounding, and I kind of thought maybe it was the Dilaudid and I would clear it up later. But what she said was, I don't think you're going to need chemotherapy or radiation. And, in my Dilaudid haze, I thought, well, that's probably really good news. And confirmed with her a week later when I was home that that was in fact what she said. And my breast tissue went off to pathology and my tumors went off for genomic testing, and the institution at which I was treated uses a different genomic test from MammaPrint. And that genomic test came back in the intermediate score range. So that genomic test for me meant that there was not a definitive course of treatment prescribed. However, when my oncologist told me that she strongly recommended that I proceed with chemotherapy, I told her what my surgeon said, and she said she was aware. And she said, I still think we should have chemotherapy. And I kept saying, but I also had another test as part of I-SPY, and it came back low. Does that do anything for me? And she felt that this wouldn't tip the scales. And we kind of just, went back and forth with it for a few days. She wanted me to sit with it. I wanted her to sit with it. And we finally decided on a second opinion. And I went to one of Philadelphia's most conservative oncologists for my second opinion. And my second opinion said to me, pretty quickly into the appointment, they had already rerun my pathology, they'd looked at my slides, she had checked my chart, she had gone through everything, and she said, I'm glad you're here because we have some new science. And it's really new science. And as a matter of fact, what the science says is that women like you with tumors like yours and cancer like yours, you're probably going to receive negligible benefit, if any, from chemotherapy. And given all of the other damage that chemotherapy can do to the body, that, minimal percentage of 1% benefit that I was potentially going to receive, I decided that chemotherapy was not going to be for me. Since I had a choice, and it turns out that the new piece of science she was referring to was a trial called MIND-ACT, which I believe was first publicized at AACR on the date of my mastectomies, which was the 18th of April in 2016. So I was probably one of the first women who benefited from the publication of Mind Act, and probably one of the first ER/PR positive stage 2B multi-tumor women who was able to confidently say, no, I'm definitely going to forego chemotherapy. And here I am 5.5 years later knowing that it was absolutely the right decision. Me and my gut, sorry to the sound guy, because I'm now tapping my mic. In my gut, I never doubted it. I knew that chemotherapy and going chemotherapy free was the only way to go. There was one other thing I was trying to remember to say, but just like the chemo brain is real, the tamoxifen brain is also real. Oh, it's the tamoxifen part. So genomic testing radically changed the entire treatment of my disease in the beginning. It reduced it from 15 months to a single day. My cancer was treated on the 18th of April, 2016, except for tamoxifen. So I took my tamoxifen religiously for 4.5 years and suffered all of the side effects that you can possibly think of, and got far enough along that I was thinking, okay, now it's starting to affect my vision. I have brain fog terribly. I'm having a hard time with some neuralgia in my feet, the muscle pain, the bone pain, all of this is real. So is there any other testing that we can do? And it turned out that there was more genomic testing that we can do. And I had it, and that genomic testing rewarded me equally as richly as the MammaPrint did. And my genomic test came back definitively telling me that I would not receive any additional benefit from 5 more years of estrogen therapy. So I could not have benefited any more than I did from genomic testing, and I'm incredibly grateful for it.
Yeah.
That is amazing. You have to be your own advocate. And you ladies are showing us that's exactly what you've done. And I hope that this says a lot to you guys, because you have to be your own advocate. All right, you are up to bat. Tell us how genomic testing, how has that affected or impacted your journey?
Well, as I left my cliffhanger before, so when I had my mammography, I was 49 years old. I was diagnosed. A couple of weeks later, I turned 50. Week after that, I had my mastectomy, and saying that I thought I was done with cancer, which I was going around telling everyone until I got the call saying, well, we're waiting for this test to come back. The doctor had told you about it, and it's called the Oncotype test. And I said, I don't remember any conversation along those lines, but okay, tell me a little bit more about it. And it took a couple of weeks for it to come back, and it came back 21. So this is back in 2012. 21 meant that it was on the low side of intermediate. What does that mean? Do I need the chemo? Do I not need the chemo? I had already said that I was clinically low. So my doctors, both my medical oncologist and my breast surgeon, didn't feel that I needed any chemotherapy, but they weren't really sure what direction to go into. I sought out second opinions, third opinions, went and spoke with someone at Fox Chase who said I absolutely needed chemotherapy. Then I spoke with someone over at MD Anderson and down in Texas, down here, and they wanted me to come in so they could ask me some more questions and evaluate it a little bit more closely, but they weren't really sure where to weigh in. I spoke to a couple of surgeon friends. They were trying to help me extrapolate and figure out where I should go with this information. And then my oncologist came back and said, you know what, we're going to run your tumor through another test, and it's called the MammaPrint test. There's a trial going on right now, and it's called the PROMISE trial. And we are actually looking at intermediate results for Oncotype and running it through MammaPrint to see where you come out. Well, I came out high risk. That was the last thing I ever expected, but I had an answer now, because I didn't want to be making that decision. And I almost felt that my surgeon and my oncologist were saying, well, these are the options, so you can make the decision yourself. We'll help guide you, but you're kind of low middle, and being that you are clinically low, we really don't think that you're going to benefit from any chemo. But when I got the mammoprint test, it told me that I did need to do the chemotherapy. And the fact that I had just turned 50, I don't really think that, I was young, and so they ended up giving me ACT. But had I not had that chemotherapy, who knows what my outcome would be, because we didn't know that the tumor was as aggressive as it showed with the genomic test. So I was so incredibly appreciative, and I probably wouldn't have gone down that route had I not had the Agendia test, because I really was not inclined to get chemotherapy. No one wants.
We're all
no
just
one really
lining up.
chooses to go down that route. So it certainly turned my treatment upside down.
So I think that was probably one of the most, in my opinion, one of the most important questions, because all of your answers were completely different, and it changed each of you all's journey in a way that that you couldn't have imagined. And you're all sitting here with me today looking absolutely fabulous. So it was all for good. Mm-hmm. All right, LaTanya, we will start back with you. I have a couple more questions. So hopefully you all know that you are not alone in this journey, okay? But knowing that you're not alone in this journey sometimes can be a big hurdle to overcome. So how did you navigate that experience?
Well, as you can imagine, my sister was my best friend, so considering that she had passed, it hadn't even been 7 months yet. I have as I mentioned, my family's really small, but my sorority, this is my soror here, really had my back. Every chemo session, there was a different person. One of my best friends, she writes for the New York Times. So every chemo session, like the first chemo session, of course, was the HER2 positive regimen. And then I was, of course, put on the Red Devil, the infamous Red Devil. And after that treatment, because I'm a former track star back in the day, I literally went to the beach and I ran the next day. And Dr. Garrido was like, what? She's like, no more. She's like, are you crazy? He was like, you're going to feel it later. But every freaking chemo session, I had my friends, my sorority sisters there. And it was really hard emotionally, because honestly, to this day, I honestly still have not totally grieved my sister's death, because I have a 16-year-old who's still dealing with the trauma, as you can imagine, that's come with like not having both of his parents, and then knowing that I was diagnosed and wondering if I'm gonna die too. So for me, it was really leaning in on my friends, and I'm a very confident person, if you haven't figured that out already. And I'm always used to being in control and like managing portfolios and just doing this and doing that. So I really had to learn how to let people take care of me, because I had been the caregiver twice, and now here I was having to sit in the chemo chair. So for me, it was really allowing friends and family to take care of me, because I hadn't done that before. And the other thing I think was doing cancer my way, because everyone, kind of wants to give you tips. Oh, you should do this, or you can't do that. And I had to say, no, this is what I want to do. Like, I dressed up in sequins every week. Every session was a theme. 1 week was Wonder Woman. Another, I'm a diehard Cowboys fan. I'll say that. But I did my journey my way, and it was with the love and support of friends that had my back.
It's definitely true that everyone's journey is different, and your support group, whatever and whoever that may be, is important. Whether you have to have chemo, whether you have to have radiation, mastectomy, lumpectomy, whatever the case may be, everyone's journey is different. So having a support group is important. So Mari, back to you. Same question. Knowing that you're not alone in this journey is a big hurdle. But how has that helped you navigate this experience?
I want to comment on one thing that you just said, and now that each one of us has had an opportunity to share our diagnoses and our journey. each one of us had not just one journey, but 2 journeys, 3 journeys. The path diverges multiple times. I don't know of anybody who had exactly the treatment and for exactly the cancer that they were told on the first day that they sat down with their surgeon or their oncologist. And for that reason, support is really necessary because there is a lot of uncertainty. I mean, my mother, when I was in my 20s, my mother had breast cancer at 47. When I had breast cancer, I was 46. So, I thought I knew a little bit about the breast cancer journey. This was breast cancer in the early 90s. It does not resemble breast cancer today, thank God, because science is moving at the speed of light. And I was also lucky enough to have a couple of friends who had had breast cancer, maybe 5 to 10 years before I did. And they were able to shed some light on some new developments. But again, science is moving at the speed of light. And we were 5 and 8 light years away by the time I was diagnosed from their most recent experience. And, I got mastectomies on April 18th. And so the science that was moving on the speed of light that day was really important to me in my journey. But I think the 2 people, in addition to my husband, who really had the greatest impact on my journey were my best friend and her husband, who at the time I was diagnosed was 43 years old and battling stage 4 colon cancer. He was metastatic. And they were the ones who gave me the encouragement and the reinforcement that I needed to continue asking questions when I wasn't sure about the answers that I was given or if I didn't understand something. They were the ones who told me to, trust my gut as I trusted the science while I was reading my chart. They were the ones who said, yeah, if you're seeing that in your MRI and you didn't see it before, you should definitely say something. And if you see something, say something is, one of my mottos. And unfortunately, Mike did not survive his battle. We lost him in 2019. But I'm definitely here today in part because they encouraged me to press so hard to get answers to the things that concerned me during my journey.
Carrie, the question again is, knowing that you're not alone in this journey is obviously a big hurdle. How has that helped you to navigate this breast cancer experience?
So when it was determined that I actually needed the chemotherapy, I remember Dr. Dupree saying, we are doing this prophylactically. We are doing this as an insurance policy to make sure that you're going to be around for your grandbabies and your children. And I went into my treatment knowing that. She also gave me the gift of recommending that I have my treatment at a lesser used site. So I was able actually to have chemo parties. And I was very vocal in our community, allowing people in and letting them know about my diagnosis. And they would come in and we would have themed, each time I was treated, we would have a themed party basically, where there could be anywhere from 2 people to 9 people. And we would sit around, we would have, whether it was a Hawaiian theme or it was over Christmas, it was a Love Actually, movie day with popcorn or what have you. And that was a way for me to allow my friends in, but also to kind of give back to them, because just knowing that I'm one of those people that likes to help people who are having a challenge in their life. I knew that a lot of people that were surrounding me were the same. And so this was a way to bring them into the fold. And I thought that was, it was a win-win for all of us. So that probably was one of the biggest ways that, I managed through everything, and it also opened a lot of doors down the line, because if people were diagnosed, they had already known about my journey, so they would call me and I could help them through their own journey.
That's perfect. And that's actually a great segue into our last question, which is twofold. And we'll start back at the top with you, LaTanya. But the first portion of that is how do you engage with the breast cancer community today?
That's a fun one. Every time I see my little picture up there with the headphones. So the one thing I did want to mention, because I forgot to mention, which I think is important considering I'm an African-American woman, both my sister and I were tested for the BRCA gene, and the tests came back negative. So as you can imagine, that stumped my oncologist, because both my sister and I were prepared to take the necessary steps to live. So that's one of the things that I know that, there's a lot of research behind that, but when you look at Black breast cancer, it's like wow. But to answer your question as it relates to how do I engage with the breast cancer community now, if you've talked to any survivor, I'm sure at some point, perhaps along the way, you've heard us say, breast cancer, or cancer for that matter, is a sorority or fraternity that you did not sign up for. I pledge one of the best sorority in the world, Delta Sigma Theta, this is my sorority sister. But cancer, breast cancer, I didn't sign up for that. But, one of the beautiful gifts that has come as a result of being a breast cancer survivor is the number of amazing men and women that I've met, and researchers and doctors and what have you. So for me, as I was going through my treatment, one of my caregivers was Guy Raz. And I'm not sure how many podcast listeners are in here, but Guy Raz is the host of one of the top podcasts in the country, How I Built This. It's an NPR podcast. And because I've always been such a tough cookie, that was what I did at night, because I didn't want to burden my friends and family with what was really going on in my head. It's like, oh my God, my sister was 43 years old when she was initially diagnosed, And my mother was barely 50. Am I going to live? But I would listen to this podcast. The NPR How I Built This podcast is about entrepreneurs who have bootstrapped their businesses. And as I started listening, I had the black nails in my hair, I had this little afro. It was bigger earlier today, but this San Antonio weather shrunk it. I started listening to the podcast, and then I started discovering these survivors who had created businesses as a result of their breast cancer diagnosis. And as I started thinking about it, I'm like, wait a minute. Are there enough to do a sustainable podcast that'll always have guests? And unfortunately, I want the answer to be no one day, and I need your help with that. But until we find a cure, that's always going to be this funnel of survivors that are creating businesses. And so I said, oh my God. So I came up, the marketer in me came up with a name, I trademarked it, did the whole thing. And then lo and behold, the same podcast that I've listened to throughout my journey, I actually got selected as one of their inaugural fellows. So I'm an NPR, super proud inaugural fellow of How I Built This podcast. And I'm super excited because I didn't know that she was going to be here, but actually one of my guests from my podcast is here. Sorry to put you on the spot, Karen. But these are all women and men who have created products as a result of their breast cancer diagnosis. So for me, the marketer in me was like, how do I reach the world? Yes, tactically, I'm doing stuff in my community. I launched a national mobile mammogram tour, which I am an honorary CDC winner, which I won that award back in May, which I'm super excited for. Because for me, I grew up in an inner city, single mother home, and it's super important for me to educate Black women, because now that I'm in this, immersed in this, and this is not, hey, it's great to see those campaigns. The marketer in me, I can be totally honest, there's some stuff that is performative. And my discernment, I know as a marketer and now a patient advocate, it's like, okay, please. And so there's some companies, it's like, I can't do that because you're just doing this. This isn't real. But there are women in inner cities and rural communities across the country that need care. And I am blessed and had the privilege to have a quality of care that I have where I'm able to go to Baptist in Miami. But there are women that don't have that luxury. Initially, when I was diagnosed, I had a less expensive healthcare program, I'm sorry, health care plan, and I was initially given a different plan, different roster of physicians. And I told Dr. Carey, I said, no, where would you send your mother? Don't look at my insurance. And fortunately for me, it was right before signing up for the new healthcare plan. So for me, that's how I'm engaging the community, to educate, but to also to approach cancer in a way that has not been done before. I'm not the person that wants to engage pharma companies because we're talking to each other. If I don't have Califia Farms or Pepsi sponsoring on my podcast one day, then I failed. Because we have to normalize talking about breast cancer outside of breast cancer. And that's, for me as a marketing person, that's the biggest challenge. And I love that challenge, and I'm making baby steps, because guess what? Agendia was one of my very first partners. And so was Mentor, the maker of my implant. So those are probably the only two with that I will, because it's my genuine story. But for me, it's super important to save as many lives as possible, and especially in the community that I come from, because the racial disparities are real.
So if you could give advice to any woman or man that's newly diagnosed with breast cancer, what would that be?
It would be, as I mentioned earlier, to, as best you can, because I know sometimes it's hard to know your family history. Because had I not known that my mother and my sister were triple negative, I wouldn't be here. And a lot of that it goes back to normalizing having conversations around breast cancer. My sister was very private. My sister was not on social media, and that's the other thing that I try to tell companies, because, you know, my podcast, the first thing, and it sounds good to say it, it's like, oh, what's your consumer insight? What's your ROI? What's your ROI, your consumer insights? When I hear those questions, I'm not interested anymore, because you don't get it. If you got it, you would understand that the most people that are diagnosed with cancer, they're not on social media. They're trying to survive. And so I would say definitely, know your family history as best you can, because it helps. It comes in handy. Definitely advocate for yourself, because were it not me having those conversations and being a people person and punching my surgeon in the arm, joking with him when he was like, the margins are really close. Because I didn't want chemo, like you said. I wanted no parts of chemo. I was like, no, I'm not doing it. But it was my oncologist who said no, because you can't take that. We can't gamble with you like that. And I also would say, again, to normalize having conversations. I know sometimes it's tough, because when you're first given that diagnosis, it's hard, it's heavy. There are times when I don't want to talk about cancer, but the only reason I'm able to do it comfortably and to do it every day, because at least 4 times a month, I get DMs and my social media accounts from people who've seen my story and they've seen me posting, and it's because they recently got a diagnosis. So the more we talk about it outside of these rooms, because we're here because it's the San Antonio Breast Cancer Symposium. The next South by Southwest conference, I'm going to challenge Agendia to be my partner, because when I make strides in events like that, that's when we're going to make a difference. Because when I think about how fast we came up with all these options for a vaccine, why can't we do that for breast cancer or cancer in general? So those are my 3 points.
Perfect. Thank you. Okay, 2-part here, Mari. The first one is, how do you engage with the breast cancer community today?
So suffice it to say that none of us are sitting here because we're shy about having had breast cancer. And not only am I not shy about having had breast cancer, I'm not shy about having had reconstruction, or having gone through reconstruction, or about not having breasts at all. I just have implants. And normalize, I think, is a very important word. I think it's incredibly important that we normalize women's post-cancer bodies. Whether we're previvors or survivors, we need to normalize our bodies. And I was just very comfortable with the entire process. I was comfortable. I'm the one who had the elective mastectomy on my left side. And thank God I did, because it turned out that, there was multifocal disease in that breast as well, and it was a second type of breast cancer. But in terms of making sure that other women around us know that we are breast cancer patients and survivors and reconstruction patients and survivors, I think is incredibly important. And I've had a lot of friends and friends of friends refer patients to me when they're in the early stages of decision making because they needed coaching or because they were just not comfortable with what their bodies are going to look like. And so, I'm jokingly called the implant model and the reconstruction model. And I cannot tell you how many dozens upon dozens of women have seen what is underneath my blouse. And that has been everywhere from doctor's office to a 50th birthday party to the dressing room at Saks Fifth Avenue. Because, if you hear a snippet of a conversation and, women are concerned and they're talking to their friends, I'm the one who walks right up to them and says, I hear you asking this question. I can show you the answer. And so that's my way of giving back.
That is amazing. Thank you for being a gorgeous model.
Thank you.
So with that said, what would be the one piece of information or advice that you would give to a lady or man that's newly diagnosed with breast cancer?
I have two pieces. And the first one is, I think I mentioned before, science is your friend. And I don't mean all of science. As a newly diagnosed cancer patient, it's not, our jobs to sit down and learn cancer. That's why we have oncologists and oncologic surgeons. But we can sit down, sorry about the mic, we can sit down and learn our own cancer from cover to cover. Every single document, every single test, every single piece of data, and every single bit of information out there. And that comes in handy because eventually, if you look at every single document, you're going to have questions, more questions than will occur to you if you don't have all of those documents and all of that information committed to memory or to your folder or to however you want to carry it around. And when you do have all of that on hand, when you see something, you can say something. You can kind of be like the TSA agent of your own cancer. And there were several times that I saw something and that things didn't seem to add up or didn't seem right. And so, I spoke up about it and I got more information and I got second opinions and I saw additional physicians. And I'm a much stronger cancer patient for it and I'm a much stronger cancer survivor for it.
Thank you. All right, Carrie, so how do you engage with the breast cancer community today?
Well, I think it's pretty obvious in terms of having this diagnosis. I started to get involved in Agendia social media. One thing led to another. I was doing podcasts and webinars with some other breast surgeons, and then I got a call asking me to come to the Agendia sales meeting, the international sales meeting, and I said absolutely, and they wanted me to share my story of kind of being stuck in the middle with a 21 recurrence score and then having a high mammoprint result. So that led me to thinking, because I had started to do a lot more research after my diagnosis and after I learned about how different mammoprint was and that it had given me that binary result of either high risk or low risk. And so after giving my my talk, I actually approached them and said, I want to work for you. I don't know what that looks like, but take a chance on me, and they did. And so, or you guys did. And so here I am, 7 years later, where I started by developing the patient advocacy program, and then that led into doing patient marketing. And now I've come full circle where I am actually working in sales, and I get to help women every day and talk to the doctors from a very organic perspective, because I have lived it. I have breathed it. I have been down the road where I've had one genomic test and then another genomic test told me a different outcome. And while breast cancer doesn't define me, it's part of my story, but it's a really important part of my story. And I'm very proud of the company that I work for because I know that it's changing the lives of women out there. And I want to make sure that women have a voice and that they use that voice to ask for the test if they're not aware that this test exists.
So what one piece of information would you give to a newly diagnosed lady or man with breast cancer?
Well, I think basically taking that a step further is, number one, know your own body, and don't be afraid that if you are not of the same mindset with your physician, I think that you have a choice. You know, make sure that whoever is on your care team is speaking your language and is working with you. And if you want to have a certain kind of outcome or test or what have you, and that physician is maybe reluctant, then maybe seek out other opportunities. I think that it's very important, you know, this is your body. You have one body, and it's important for you to advocate for yourself. And as we started coming full circle, knowledge is power. And that is what we each have. And I think that it's essential that we feel that way and act on it.
Well, I'll tell you something. You ladies are absolutely phenomenal. You all are the epitome of strength, resilience, and you have tons of reserve. I mean, look at you guys. You ladies are just amazing. But thank you all for trusting the science. You know, there's something to it, right? And as, you know, we all know there's more research to be done. And, you know, thank you to all the researchers and everyone who is continuing this journey. Thank you for all that you do. But, you know, thank you for giving it to us, you know, as physicians to be able to give to our patients and survivors and helping them become thrivers. So I just want to thank you ladies for being here. Thank you for the strength that it takes to tell your story, right? Because once again, this does not define you necessarily, but this is a big portion of your story. So thank you all for that. Well, thank you all. Thank you for coming.
Thank you.